Welcome to our show IIT2020 Impact Fireside Chat Series. We invite thought leaders and innovators to discuss their approach to the future in the current and post-pandemic world. Today, I have invited an exceptional guest, Dr. Gautham Reddy, a family medicine specialist in Las Vegas, USA. He has 25 years of experience. He is a graduate from Bangalore University, and he did residency from New York Medical College. He is one of the leading doctor and expert in integrative medicine too. He has successfully treated hundreds of COVID patients, several of them older than 70 plus years of age. He has become the voice of COVID patients, and he is leading with scientific data. He believes in evidence-based medicine. He speaks about longevity too. Dr. Gautham, let's talk about your journey as a doctor in East and West, because you have worked in both countries. What do you think about that?
Yeah, so, my practice to medicine kind of evolved over my own career. I graduated in India, came to residency in New York, and then, settled in Las Vegas. And through my years in practice, I basically evolved into integrative medicine, which for a lot of people who don't know what that is, it's basically taking your MD model of medicine and then integrating that with other holistic approaches that are, well known for thousands of years. And it kind of takes the best of all worlds and multidisciplinary approach in that manner. And it's been a very rewarding experience. And I think it had a big impact in how I approached COVID-19 and the treatment strategies that we instituted in our clinic.
So let's talk about that for a minute, because that's the biggest problem we have today. The COVID has changed, or pandemic has changed our world. And patient care is becoming a huge issue. And you are first responder, and especially last 6 months, you have seen hundreds of patients. So you also change the way you do practice today. We talked about it, telemedicine and all.
Right.
But overall, let's talk about, what is really the biggest challenge today? Do we even have enough understanding about this disease?
Yes. So the first thing I'd like to say about the disease itself is that there's a lot of fear driven. There's a lot of fear of catching the disease, and what are the strategies to prevent catching the disease. And I think, the one big emphasis is, isolating yourself and social distancing and wearing your mask, and very, very big emphasis on those type of things. Those are basically barrier methods. The one thing that I kind of stressed upon my patients, my family, my staff, is that, that's an external barrier. That's well and good, but we have to do more than that. We have to have an internal firewall to our immune system. So I personally practice these principles and really instituted, that as a policy in our staff to take care of their immune system. My office manager actually goes around at lunch hour and gives all the staff the few supplements that I recommended.
Wow.
And I do the same for the family and my patients, and it has worked very well.
So I really like your analogy of firewall. Yeah. That's a tech analogy. So
Yes.
Thank you for thinking about it, because almost 30 to 40% of our audience are engineers.
Right.
And mostly from tech space. We have half a million IIT alumni globally in 100 plus countries. So why don't you give them your formula of this prevention at this point of time?
So basically, in my early days of learning about integrative medicine, one of the big focuses of health was, not letting your body become D deficient. Out of 23,000 human DNA, 2,000 of the DNA is regulated by vitamin D. It impacts your immune system. It impacts your ability to fight cancer and autoimmune.
How many DNAs you said?
2,000. 2,000 of our 20.
So these are the markers.
Markers
Okay.
that it has regulation, codes for instruction to give your body. So going back to that is, one of the few one of the most important factors is, immune modulation for D. And when you talk about immune in systems, you're really talking about not just your infection battle that we face, but also your cancer battles and your autoimmune battles. All these have a huge impact with vitamin D. So when COVID-19 came, it was, a very quick thought for me to say, you know what? We don't know what this virus is about, but we have to go back to what works. What works is having a strong immune system. We do this every winter. We do this during air travel. I've done this for decades before, even before COVID, trying to stabilize the immune system so that we have better outcome. So to my surprise, actually 6 months into COVID, we instituted a high dose of vitamin D. There's maintenance dose of D and there's high dose of vitamin D. So maintenance dose is what you take every day when you're feeling well. High doses of vitamin D we use during actual infection times.
So what is that?
So, normally let's say the dose would be about 5,000 units per day. We use 5 times that for a week.
For a week, okay.
And basically...
So you build the immunity with that and then you go down.
Get high levels and then you go back down to your baseline dose.
So even in Vegas, we need high level of... We have sun, like, it's crazy. You go out for 5 minutes and you just burn.
You do, but the thing is that that's actually a very good question. We burn differently. If you have very light skin, you probably need 20 minutes in your bathing suit to get enough of D for the day. If you have very dark skin, it could take 4 hours of bathing suit time. And that's one of the big impacts that we see minorities having high impact of deaths in the United States. Out of 200,000 deaths, 50% of those deaths are 2 large groups, is nursing home residents and African Americans. Wow. And those 2 groups are notoriously low for vitamin D deficiency, yes. So that along with multiple studies that have now come from Northwestern and recently this week from Boston University that actually showed vitamin D deficiency increases mortality rates, and it also good levels of D decreases ICU admissions.
So it's not fictitious, because I'm hearing about it, and I started taking vitamin D 4 years ago. I never took it, and I spent most of my life in California and traveling all over the world, but mostly in sunny part.
Yeah,
mostly. So I thought it is more for the people who live in Michigan or Minneapolis and that part, especially in winter when you don't have sun. So you are saying even if you live in Las Vegas or California, you may have a substantial deficiency of vitamin D.
Yeah.
And just that vitamin alone can change the way you deal with not only COVID, even other diseases or problems such as allergies and other immunities you need.
Yes.
So where are we today? What do you see as a future? And specifically, my question is, what can we do with technology? Because we have so much data out there and so many things we can do today, which wasn't possible a few years ago.
Right. Some of the impacts of medicine that is unforeseen in COVID-19 is that routine patients are ignoring their medical care for other routine diseases. I've had situations where I've noticed my diabetic patients have not seen me this year. And as far as the challenge to the IT engineering sectors of the world is to look into what to expand telemedicine to diagnostics and to improve access to laboratory medicine at home. That would be a huge benefit to medicine in general.
So we were talking about the data in medicine. Mm-hmm. So what is your take on evidence-based medicine?
I mean, it's very important. I mean, we use that on a daily basis when, drugs and things are not approved by the FDA, especially in the United States. When you have a situation with the pandemic, you used early evidence-based medicine on the studies that came from all over the world to impact our treatment, because it's a very fluid situation. So it's not only important in long-term diseases, but even an acute crisis situation like that. And that's where, a lot of the data came from was studies in Spain and Northwestern University and recently Boston University about the impact of vitamin D and really decreasing ICU admissions. And that really relates to decreasing deaths.
True.
So far, I'm happy to say, this is only 6 months into the disease. We've not lost one patient to the disease.
Wow. And how many patients above 70 you have treated?
A few dozens. Yeah, a few dozens.
Wow.
Yeah, at least
That is impressive.
Yeah, I would say out of the 220 patients, we've had probably about 50 people above 65 years of age. The oldest one being 99.
Do you see a future, near future, not too far, where people can have these self-testing equipment and kits in their houses, just like testing a blood sugar level, to do these kind of tests too?
Yes, I think that'll be the future of medicine. Even in the short amount of time I've adopted to use telemedicine for all the several hundred COVID patients I've seen, I did not see them in the office. It was all through video. We basically kept the clinic sterile with non-sick patients so that there is no contagious disease in the office. And then we kept all the suspected upper respiratory illness and COVID-like symptoms in the telemedicine platform. So, to extend that, more diagnostics that are created for at-home use would have a huge impact in care, where we won't have patients avoiding the doctor's office for a year and sitting home with diabetes and diabetes complications. So, there's probably has to be so much research into studying what is the impact of COVID affecting other diseases by, deferring their doctor visits, So there's a big value for the engineering world to come up with solutions for home diagnostics.
So when people start doing this self-diagnosis, how far should they take it? Because I'm going to ask a controversial question. A lot of people are doing these different kind of DNA testing. And these DNA markers are telling people they have certain kind of diseases, or they are prone to that. So are we looking for the diseases we don't have? Do you see that as a problem or a counter deterrent to these innovations?
Obviously the more information you have, it's better. But some people get anxiety based on those type of diagnostics, and I think they should be probably discussed with the physician and not interpreted themselves, because it creates a lot of misinformation and fear. So I think I always value all information, but I think it has to be done in the right platform, and getting a very deadly diagnosis and treating it and dealing it with yourself is a little bit risk for foreseen problems too.
True. No, I completely agree with you on that. So question I have is, when we talk about personalized healthcare,
right,
what is your take on that?
Well,
are we taking it too far, or?
No, actually, it's actually very, very relevant. You have genetics, and then you have the term called epigenetics. Epigenetics is how you handle your body with your physical activity, nutrition, supplements, and how that impacts what your genetic predisposition was. So you can impact it even if you have cancer genes or cardiac genes. You can actually alter your epigenetics by working with an integrative medicine doctor that is very well trained in preventative strategies, nutritional strategies that have a tremendous impact. And there's one gene that needs to be mentioned is this MTHFR gene. It's impacts probably more than 60% of the world. And a lot of people don't know they have that gene. And it has a huge impact with cardiac disease, cancer, autoimmune conditions, psychiatric conditions.
Just one gene.
Yeah, we always knew, some of these diseases run in families, because that's kind of like a common knowledge. But now we've kind of isolated the gene that seems to be, transferred from generation to generation. So
Wow.
just even having the technology to do that now, it's been beneficial. So now we kind of reverse the gene defect. So that's already being, utilized. But there's probably more to be done. This was just one gene I'm talking about.
Today, I wanted to really talk about the scientific research happening in the health space purely. And we talked about the remote or self-at-home testing kit. What I hear from you is you do believe, definitely there's a lot of research happening, we all know that, but this is going to be mainstream, where people will be self-diagnosing themselves. So then the next question I have is around artificial intelligence. And for our audience, this can be a big buzzword, but you are living and breathing that in every single aspect of healthcare.
Yes.
So what is your take on that? And where do you see AI has ability to change or improvise the health, and where you see that it is more of a fiction or more of like just a dream?
Right. No, I think I have high hopes for AI. I think there's two areas that we can, comes to mind right now is, of course, the home diagnostics we talked about, whether it be electrocardiograms, pulse oximetry, blood pressure monitoring, blood glucose monitoring, integrating that into the electronic medical record system, and having up to the minute data from every patient. That would have a huge impact. And the second one that would be a huge lifestyle change is AI for dictation. I mean, doctors spend about 8 hours a day seeing patients, about 1 to 2 hours a day dictating or typing. Still.
Wow.
So so
now we have the Google and Siri.
So you have some technology that's already there with voice prompt dictation, but true AI in a doctor's office is a technology that can actually dictate a conversation and not just a voice dictation. So that would be truly beneficial.
Adding the contextual aspect
of what the patient's saying and what the doctor has interpreting, and that would be that. I do hear that the technology is kind of in the beginning stages of discovery there, but that would have a huge impact to every physician on the world.
It's a new Apple Watch, which I have here. I'm sure everybody has seen it in our audience. Now, this watch can measure my ECG, and it has even the oximeter, which was the biggest challenge, and we couldn't find in the market enough of those. So the new watches have all that. And what I hear from you is that data will be collected. The data will be shared with your physician or whoever you wanted. So do you see these kind of applications have more wider adoptions now? People will be comfortable sharing their data.
Yes.
What is your take on that?
Well, what we've seen with COVID is, exponential growth in telemedicine space. So with that, it really helps to have more diagnostics available to your patients at home. One of the rudimentary things we were doing with every patient is many of the patients acquired pulse oximeters at home.
Yeah.
And every day we would follow up on the COVID positive patients. We would be monitoring their numbers at home and seeing if anybody needs to, advance
go
their
to the
care
hospital
to
or
the
ER.
hospital and things like that. So it was invaluable. So
very cool. So when we talk about oximeter, when we talk about all these devices, the big concern I personally have and our audience have is, I'm pretty sure, is privacy of the data and the misuse of the data.
yes.
So, and especially if the data going into, for example, if the data is being utilized and wrongfully penalizing people, insurance company, to our health system, to all other areas where it can be used against us.
Correct.
So what's your take on that?
I mean, that's actually a bigger question for your world than my world is how do you keep the data encrypted where, it's not sold to third-party vendors and it affects your life insurance, your health insurance premiums, things like that. So that is a big challenge, but if that can be overcome, I think we'll have a very integrated world where, like you mentioned before, if there's a spike in a certain disease in a certain hotspot of the world, we can see that why is there, so much of one particular diagnosis lighting up in one part of the world, and we can probably have better awareness for the next pandemic.
Yeah, no, I personally believe that we are more connected than we think. Especially in the last 9 months, we try to isolate ourselves in our homes, and look what it has done. Yes, you can be COVID free, but can you survive?
Correct.
And it's not just surviving physically, even mentally. What you see we should do as a society, where we believe that the information we are sharing about our health is safe. Is there any areas you see we should think about it, or you think it's going to be, as we are going to face the problem, will solve itself?
Yeah, it's a difficult question, but I mean, I think the technology is going to be key in many sectors of healthcare, whether it be information gathering on a global scale, or even diagnostics on an individual scale, like we talked about. I think the areas that are key are, information sharing of global statistics. That would be one. The second would be, improving diagnostics for at-home testing would be the second one. The third is, the artificial intelligence, which, I think it fascinates everybody, but it has a huge use in day-to-day medicine. We would definitely welcome the technology to our practice once it becomes viable enough to take over the documentation of each visit. That will have countless savings of hours to all medical providers in the world. So I'm rooting for that one first.
So, Dr. Gautham, I always think, and I'm a fan of technology, of course, because I live and breathe technology, and I'm in this industry for almost I would say 3 decades now. Less than that a little bit, but yeah, at least 2.5 decades, 2 decades. And I've seen the evolution of technology. I've seen how from mainframe to client server to now we live in a cloud, and where we don't even know where the hell our data is, which is concerning and scary sometimes. But I personally start believing is we are very connected. Anything you do, it has ripple impact to every single citizen on planet. So we have to see the whole society as one, and our actions impact every single human being. That's a big problem I see. So when we talk about artificial intelligence, on one note, I think about it all the time is we can digitize a lot of the information people like you have in their brain, and make it easily available to general masses, including us, so we can have better quality of life. But at the same time, there are some very unique skills.
Yes.
Humans develop. These are the outlier kind of things. How do you train that to computer is a challenge. So I'm not sure what is the future of a doctor.
Right.
And on the same note, we are going to have 3 billion more people. I don't think we can train fast enough doctors, physicians, and build the whole healthcare system to support them without technology. So where do you see are the balance? What areas you see there are we can improve quickly, or what areas you see now we should not focus on that? So for major impact.
Right. I mean, as far as going back to artificial intelligence, I mean, radiology, I think, is probably one of the ones that will be impacted first. It's less clinical based, more visual based diagnostic tools. So that area I think will adopt fast. The second is, of course, my favorite is the dictation to every office, because
but you don't need
when you become much more efficient as a physician, you're able to actually do more valuable service than menial jobs. If you can have artificial intelligence do menial jobs in the healthcare world, that'll be a very good adoption by the medical community, and not as a threat, but as an asset. The other, third one that, as you ask me the question, it comes to mind is a lot of times I spend Monday mornings calming people down of what they Googled Sunday night. They basically, type in their symptoms and they all think they're going to die.
Yeah, that's true.
And I just say you're not going to die and they're happy already. So that's kind of one of the fear factors of just having a Google search for medical symptoms, is that there's a lot of unnecessary information that comes in the search that it seems to be actually detrimental than helpful. And AI can help in sorting out those diagnostics on a individual basis.
So you mean to say that placebo really works? The sugar pill really works. Do you prescribe those too?
Maybe vitamin D is placebo. I'm just kidding. No, I'm just kidding.
So Dr. Gautham, it is really fascinating to talk to you, and I can talk to you for countless hours. Then we had a great conversation even before we started recording.
Yes. Yeah.
So the last question that really I have for you is two questions actually. One is, I'm just a regular Joe, and I'm going and struggling through all the challenges around the pandemic. Mm-hmm. What are the 2 or 3 things I should do so I can build a better immunity?
Yes.
And second thing is, for the technology, for the technologists who mm-hmm. are watching this event, what are the 3 things you say focus on? I understand the transcription and all, but it's not exciting enough because what I believe in is we have to change the dialogue. IITians have built several or thousands of multi-billion-dollar organizations, but the conversation has to change. And this time, we want to talk about how can we impact billion lives. So we want to take the problem which are really, really substantial, and how can we have better quality of life for ourselves and our future generations.
Right. Well, for the first question, how you can make a difference for yourself as far as improving your immunity. The 3 sections of health are really your sleep, your exercise, and your nutrition. And when, obviously having a very good diet, less processed food, less sugar, the supplements that I would highly recommend during these COVID times is vitamin D, vitamin C, and zinc. And for your second question, as far as, how can the engineering sector assist in, global health and future pandemics? Obviously one is information sharing. I think if we had private data during the beginning of the pandemic, and if you could create, a
better sharing system
where you're not relying on a government's willingness to share the data or not, and have individuals' data points be shared across the globe with private platforms that we share every day. We go on social media without government permission, and we share the information. And a lot of the initial information that was shared amongst doctors was through social media platforms about what's working, what's not working, and that had a huge impact for the cities that actually got it later on in the disease. You see their outcomes were much better because of the sharing of the information.
Data sharing. Yeah. So, Dr. Gautham, this is really, really fascinating conversation, and I really enjoyed it, and I'm sure our audience got a lot out of it. There are some other questions I wanted to ask, but I will share with our audience, and maybe in future we can talk about it. So, Dr. Gautham, with that, I'm going to end our show today. I want to thank every single person who is watching it on Facebook Live, as well as the amazing group of people we have. I want to talk about IIT 2020. IIT 2020 is our attempt to bring anyone who wants to impact humanity, who wants to impact and change the world with engineering. This event is open to all. It's not only for IIT or IITians. We invite everyone. It's all inclusive. Please register. Go to IIT2020.org and register and be the part of the movement we just started. Thank you.